program is easy access to healthcare for all, bringing you news and issues around the National Health Insurance Authority. The healthcare provider is a foremost stakeholder within the health insurance ecospace. They interface directly with the enrollees when they visit their facilities. In today's episode, we will be discussing with authorities of University Health Services, Jaja Clinic, situated at the University of Ibadan. The facility caters for over 10,000 enrollees aside the Tiship program that covers students of the university. We discussed the impact of the program, how it has helped them evolve, as well as their challenges in implementing the health insurance scheme. Please stay tuned for details as we take you through the full program. My name is Aisha Muhammad Ahmed, your regular anchor. See you when I return.
Let me see your bill. What is this in your bill?
Oh, it's Tiship fully paid. Are you an enrollee? Are you registered under the Group Individual Family Social Health Insurance Program, Tiship?
Tiship. What is Tiship? Tell me about it.
Tiship is a group individual and family social health insurance program. Now, the health insurance is mandatory for every Nigerian. Tiship allows artisans, traders, farmers, mechanics, business owners, taxi drivers, even keke riders benefit from a range of medical surgeries, medical tests, scans at any preferred NHIA accredited hospital in Nigeria. To enroll, an individual contributes only 45,000 naira per annum. For a family of 3, 45,000 naira per annum. Group of 10 persons and above, 15,000 naira a person per annum. This amount is renewable every year.
First on the program is a highlight of events around the NHIA. In our lineup, NHIA reviews reimbursement process for its cost-sharing partnership with Roche. These and other stories coming up after the break.
The NHIA Roche cost sharing with Roche and Pfizer is a major achievement of the National Health Insurance Authority to provide subsidized cancer drugs for enrollees when they visit facilities. The cost sharing program kicked off in 2022.
Objective of the meeting.
The National Health Insurance Authority NHIA on Tuesday the 2nd May 2023 organized a meeting to review the reimbursement process of the NHIA cost-sharing initiative with Roche and Pfizer to provide subsidized cancer drugs for enrollees when they visit health facilities. The meeting brought in the cost-sharing implementing partners and the health maintenance organizations who are responsible for the reimbursements on the program, as well as the project working committee. The objective of the meeting includes to assess the process of the cost-sharing segment of the initiative, to identify challenges in payment under the initiative, and to co-create solutions. Speaking at the event, Dr. Yakubu Agada Amade, General Manager Standards and Quality Assurance NHIA, said the essence of the meeting was to strengthen the program and further spell out a better means of reimbursing the implementing partners.
We've run this project, the cost-sharing initiative for the NHIA, for getting to a year now, and so we're sitting down to review the whole project, especially the reimbursement aspect of it, to see how we can have a more perfect system, a better system, where the drug companies will be able to get their payment on time, and then the HMOs will be informed that their enrollees are at the hospitals on time, and also that the HMOs will get the claims for the drugs on time.
Modupe Ogundimu, General Manager Contribution Management, gave a brief rundown of challenges that need to be clarified.
One of the issues that we observed, and this was basically from the data that we got from Roche and from the data aggregators, is that some of the NHI numbers are at variance with the enrollee details. So it took a bit of a deep dive into some of the information that we hoped before we could actually match the names with the NHI numbers. Now, whether we want to believe it or not, the NHIA number for now is our unique identifier. And if we cannot match that with the enrollee details, both based on the HMO and the enrollee themselves, then it's going to prove a bit difficult for us to know whether this enrollee is actually an NHIA enrollee. So at the first glance, we need to be able to know who exactly the enrollee is. Is it an NHIA enrollee? So these details are very, very key at all levels. The other thing that we notice is that some of the enrollees, again inadvertently, have been associated with HMOs that are not actually their organization's HMOs. Again, it took some knowing the system to understand who actually was who. So at a glance, one could not determine who actually granted the authorization code.
At the end, there were various presentations from both partners, after which participants were grouped to discuss the issues for recommendations. The Managing Director, Chief Executive Officer, Ultimate Health Management Services, Mr. Lekon Ewenla, has said that Nigeria will record an increase in coverage under the National Health Insurance Authority in 2023. He said this while speaking with newsmen in Abuja recently. Ewenla said after several years of failed efforts to repeal and replace the NHIA Act, it has been finally achieved in 2022 and will change the narrative and concept of health insurance in Nigeria. He added that the full implementation will be felt more in 2023 because the new NHIA law has made health insurance mandatory for all Nigerians and legal residents in the country. Ewenla further shared this confidence in the leadership of the authority as being well grounded in the concept of health insurance and health financing, with the capacity to work closely with the critical stakeholders like the health maintenance organizations and the health care providers, as well as all who matters within the health insurance space to attain universal health coverage.
The NHIA has a mandate to give Nigerians accessible and affordable health care. Its stakeholders cut across different zones, but those who interface directly with enrollees are the healthcare provider or hospitals. These institutions are accessed based on the choice of the enrollee. However, enrollee satisfaction is a top priority with all of them. In our next segment, Issues Around the NHIA, we shall be looking at the operations of University Health Services known as Jaja Clinic in Ibadan, Oyo State, and its provisions of healthcare for NHIA enrollees. Keep watching.
University Health Services, known as Jaja Clinic of the University of Ibadan, is one of the healthcare providers under the National Health Insurance Authority operating in Ibadan, the Oyo State capital. The facility caters for the health needs of enrollees ranging from primary, secondary and tertiary care, with special provision for physiotherapy, laboratory upgraded facilities, as well as some specialist clinics such as mental health and optometric management, among others. Dr. Bello Jalili, Chief Medical Director, University Health Services, Jaja Clinic, speaks on how the hospital keyed into health insurance.
Yes, University Service is the name given to this health facility, and its clinical component is usually commonly and popularly called Jaja Clinic. So it's an accredited NHIS facility that renders primary care, some secondary care, especially in the area of physiotherapy, laboratory upgraded facility, upgraded tests in the laboratory, and of course, some specialist clinic in the area of mental health management, orthopedic management, management of hypertension and diabetes. So we have secondary service in that regard. And of course, we will also refer, when necessary. So those are our clients are essentially that of staff, our enrollee, their staff, although it's optional, but majority of our staff use University Service as their primary care provider. We also have students through Tiship. In fact, it's mandatory for all of them to be with us, and the other civil servants in the federal government establishment also have the option of picking University Service as primary care provider.
Dr. Shodeke Olarewaju Aboderin, Acting Managing Director, University Health Services, Jaja Clinic, have been a part of the health insurance program, speaks on the impact of the program.
Let it be sustained. Yes, let NHIS be sustained. I hope that the government coming in, new one coming in after this, will continue or even improve on it. It's a good program. No doubt it's a good program. Generally, NHIS. It should just be expanded, and all the programs they had in mind, all the schemes, also it's a scheme, all the programs for pensioners should just be fully implemented. That will help. Well, I want to wish NHIA very well. I want to encourage them to continue what they're doing. In their own way, they have transformed health service, the care, particularly the funding. They have done it very well. Wish them well.
There is also high optimism that health insurance will change the narrative of the Nigerian healthcare space.
Well, since the NHIS came on board, certainly it has improved healthcare in the area of the funding aspect. We now at the University Health Service, that is a major source of the fund, though we at the moment don't have access to it directly. And then we've seen that other places, since NHIS came on board, that funding aspect has been seriously addressed. That's why you see some more people are joining. If you just go by, you see even the private health service, they're advertising that the NHIS accredited. So there's no doubt that NHIS coming on board has helped healthcare delivery in Nigeria.
Health insurance, that's the main source of funding for all health facility in Nigeria, and not only public, even private, regular source of funding. So there's no gainsaying the fact that the system now, the health system in Nigeria cannot survive without NHIS. So, and Jaja are of course keyed into this, joined this more than 10 years ago. And I think we have good romance with NHIS, and I think our clients are benefiting.
University Health Services has evolved over time from when it started, enabling it to give enrollees quality care when they visit the facilities.
Our facility primarily is a primary health care at the inception. The concept is to have a primary health care center. But over time, and especially since NHIS came on board, we've been able to have other units added. At the moment, we're no longer primary health care, we're now comprehensive, because by the time we now have optometry, we have physiotherapy. So all those other units coming to join has made us not the primary health care that was at the inception, but now a comprehensive. And NHS has done a lot to help us do that. Otherwise, I'm not sure we'll have been able to do that without NHIS coming.
This facility is not just ordinary primary health care provider. It's a comprehensive, like I told you earlier. So it goes beyond providing primary care. Then a comprehensive health care is the one that has a good mix of preventive and curative. So for us here, apart from providing primary care, we also provide some secondary, as a kind of soft landing for our clients. So I think we are doing fairly well because our scope is wide. It even goes beyond primary. What that means is that when the cases that are supposed to be referred for secondary care, some of them can be handled here through our secondary product.
The common challenge encountered within the health insurance space is one that arises between the healthcare facilities and the MHO But unlike other facilities, Jaja Clinic seems to have a mutual understanding and cordial relationship with its HMOs.
We don't have a problem with HMOs. I know maybe there are a little misunderstanding with since now we have the students, the Tiship that came on. Maybe a little misunderstanding at the time, because the HMO that handled the Tiship at the first time, maybe they expected they would just continue to handle, but then I think the authorities had reason to want to review who would be the HMO for the students. But for the staff, they've been stable since inception, the same HMO for our staff. And we've not had issues. But they have even brought in innovations, because they brought innovations, some honorarium just to encourage the staff, and they've done a lot, the HMO for the students, for the staff. For the students, because that's a newer program. Before we were handling it, before we had to bring HMOs in, to comply with federal government's directive. So it's a newer thing. Maybe it's just a teething problem we're having. It will stabilize. So by and large, that's how it has been with the HMOs.
We have cordial relationship. Not cordial in the sense that we see ourselves as brothers and we meet regularly with our HMO. To the extent that, in fact, the other soft landing they give, in terms of training, support, finance, to support even training of our staff, so that our service can be delivery can be top, notch. So I think we are good with all our HMO and we meet regularly.
Welcome back from that timeout. Easy access to healthcare continues with our stakeholders segment. University healthcare services is still our focus, but this time we chatted with Jaja Babatunde Olorufemi, the NHIA desk officer at the clinic. As a stakeholder, he speaks on some of his responsibilities to the NHIA enrollee.
We try to oversee the NHI's activities from the beginning to the end, and then try to intimate each unit about the regulations and then the new development in the NHIS. So, and then we inform the director too, and then that's the way we work basically. The enrollee do come, we attend to them, then if there is any hindrances in them assessing our medical services, we try as much as possible to help them to sort it out, and it's part of our work as a social worker too in the facility. So we make things easier for them to it easier for them to access our service in the clinic.
The Health Maintenance Organization serves as a middleman between the National Health Insurance Authority as well as the healthcare facilities. Olorufemi speaks on how they relate with both stakeholders.
The HMO that covers the UI staff is Ronsberger, but we have other HMOs too that they are enrollees. They have enrollees with us in Jaja. But because the Ronsberger is our major HMO that covers UI staff. They also have a staff working in this office too. So with that, relating with the main HMO that we have for the UI is easier for them since they have office in this, they have a table in this unit. But for the other HMOs, we do make calls, then from that we get the code for the enrollees, and then if there is any complaint whatsoever, we always communicate it to them, and once in a while they do visit us here to know what is happening and how they can help us to resolve that. And if there is a need for them to come down before they intend to do so, we also call on them to also come to our facility. So then periodically we do have a meeting with some of them.
In closing, the desk officer speaks on some challenges encountered in the operation of health insurance in Nigeria.
Sometimes it do take a little bit of time, but we can always call them to the attention of the fact that this thing should be released on time. That is, initially, we started by making a phone call. Later, we graduated to sending text messages. But this, and especially during that time of making phone calls, is a bit, can I say, financially demanding. You have to explain in details and what have you. But now, many of them are now coming through the, getting a code through WhatsApp, which made it a little bit easier, and then less, it consumed little credit for you to do that unlike before. Then, in that response time, we always call the attention of the senior officer in that organization, I mean the HMO. We call the attention to it, and they quickly work on that.
That was Jaja Babatunde Olorunfemi, NHIA Desk Officer at the University Health Services in Ibadan, sharing his thoughts on the operations of health insurance in Nigeria. We will now take your questions in our last segment of the program. Keep watching.
Where do I register? How can I get enrolled? Where do I register?
How can I get enrolled? How can I get enrolled?
Question: what are the contribution sets for the informal and formal sectors?
The contribution sets for the informal sector, the main contribution set is what we call the Basic Healthcare Provision Fund, which is an intervention program by the federal government. 1% of the consolidated revenue from that has been given to states to cover their vulnerables, and the states will obviously give counterpart funding so that the program is actually sustainable. So the government pays its own part, and the states that are part of this will give their counterpart funding so that they can actually cover their vulnerables. For the formal sector, formal sector is largely contributory. In the federal government formal sector, which is our major formal sector program, we have about 3 categories. So we have those that are paid on behalf of federal government because they are treasury funded. So the federal government deducts the health insurance component from their salaries at source and then disperses those funds to the scheme, and we then cover those people once they're registered.
That's our package for the week. The NHIA is not leaving anything to chance in ensuring that quality health care is delivered to enrollees. It is a system that serves every one of us. Let's do our part by keying into its different programs to be able to access care when the need arises. See you next week.